All right, let's do a rapid-fire review of drug forms. We're going to master the core knowledge you're going to need to ace your exams and be safe out on the floor.
Got that big pharmacology exam coming up? Don't stress. We're going to quickly and clearly break down the essential drug forms you absolutely have to know.
So we're going to be working right from this guide here. My goal is to make every single one of these terms totally clear for you, so you can walk into that exam feeling confident.
Okay, first up, Section 1. We're diving into oral and ingested medications. The drugs your patients take by mouth. Let's start with liquids. Now, for your exam, the absolute key is knowing the base ingredient. Syrups, they're sugar-based. Easy. Elixirs use glycerin, and that's what makes them pleasant tasting. Then you have tinctures, which use alcohol. And knowing this difference is so critical, especially when you're looking at a patient's history or potential allergies.
Moving on to solids. Pills are just tiny, sugar-coated tablets. Capsules, you know these, are the little gelatin containers often filled with powder. And lozenges are meant to dissolve slowly in the mouth, so they should never be swallowed whole. Simple stuff, I know, but these are easy points on an exam.
All right, let's get into Section 2. This is all about drugs you apply to the skin or that are inhaled.
Okay, creams versus ointments. This is a classic exam question, so listen up. The crucial difference is the base. Creams are water-based, so they're lighter and absorb more easily. Ointments are oil-based, which makes them greasier but also creates a much stronger barrier on the skin. Just remember, cream equals water, ointment equals oil.
Sprays are pretty straightforward. The drug is aerosolized, which means it's turned into a fine mist. This is perfect for either inhaling into the lungs or getting a nice, even application on the skin.
Now here's a less common one you should know, Vitrelay. These are tiny, sealed glass capsules. To actually administer the drug, you have to physically break the capsule, which releases a vapor for the patient to inhale.
And this leads to a huge safety alert. Because Vitralia are glass, there's a real risk of cuts. So you have to use a gauze pad when you break them. This protects you and your patient. Patient safety is always the top priority.
Okay, our final section covers drug forms that are inserted into body cavities. You'll want to pay close attention here because the terminology is very, very specific.
This is a distinction you absolutely cannot get wrong. Both pessaries and suppositories are cone-shaped solids. The only difference is the route. Pessaries go into the vagina. Suppositories go into the rectum. Confusing these is a critical error, so please lock this in your memory right now.
All right, let's wrap this up with some high-yield reminders that are going to help you ace your exam and make sure you're practicing safely.
Here's a simple little trick to remember those liquid bases. For syrup, S is for sugar. For elixir, think of the E sound in glycerin. And for tincture, remember that L near the end is for alcohol. Trust me, little memory aids like this can make a huge difference on exam day.
So, what are the big takeaways for you as a future nurse? 1. Always double-check the administration route. Is it a pessary or a suppository? 2. Know the drug's base. You wouldn't give a tincture to a patient with an alcohol dependency, right? And finally, it all boils down to one thing: patient safety. That is your #1 priority, period.
So I'll leave you with this to think about. As a nurse, you'll be teaching patients how to use these meds all the time. Which one of these do you think would be the most challenging to explain to a patient, and why? Thinking about how you'd actually apply this knowledge is the final step to mastering it. Good luck with your studies. You've got this.